Welcome everyone to a great session today as Workday and Huron provide you an overview and demonstration of our healthcare demand planning solution. Before I introduce myself, I had a few housekeeping items I wanted to mention. Yes, all lines are muted, but be assured that you can use the Q&A window at the bottom of your screen to ask any questions that come up to mind throughout the session. These questions will be answered at the end of the presentation. And lastly, the session will be recorded and available shortly after the event, in case you want to go back and listen or share with your colleagues. We have a great panel of speakers today. My name is William Bursick. I am a senior healthcare product strategist for Workday, focused on planning and analytics with over 30 years plus of healthcare IT experience. We have two presenters, Ida and Nick, from the Huron Consulting Group, and we are honored to have David from Dayton Children's Hospital with us as well. They will introduce themselves when they are up to present. With all that said, let's get started. I first wanted to mention an article as a key quote as to why this is so important to healthcare today. This article titled Trust, Cost, and Quality, Why Healthcare Supply Chain Must Transform, was written by three gentlemen from the Huron Consulting Services team. The critical point they made in bold that I've mentioned here is that it's imperative that healthcare supply chain must evolve quickly to be able to forecast and adjust to shifts in patient volumes and sites of care. But why? Why now? Demand planning has been a beneficial exercise for healthcare organizations like yourself, but recent trends have particularly highlighted its necessity. We've seen consistent declining reimbursement rates that apply pressure to financial margins, and now seeing this pressure compounded by COVID-driven volume declines. It's now more than ever, organizations must have a robust understanding of their operational and financial performance, with the ability to pivot as quickly as required to not just remain viable, but truly thrive. Supply chains must be more resilient and flexible more than ever. The clinical workforce must be efficiently deployed to ensure the right care is provided at the right place and the right time. So patient access is also imperative, and the need for insights to adjust shift volumes to outpatient settings is critical. While this pandemic will hopefully end soon, the resulting implications will last much longer. And the path to value-based reimbursement models will only be accelerated as organizations who are already far along this journey were able to secure more consistent reimbursement than those who were more reliant on volume-based payments. These changes solidify our reasoning for creating a demand planning solution today. And the reason for why Workday decided to partner with Huron. We believe that Huron's subject matter expertise, not only in the healthcare industry, but with supply chain management experience, combined with Workday providing the solutions and the platform, we created a complete demand planning solution. Let's get into more details of the solution and see a live demonstration. I will hand it over to Ida from Huron. Ida.
Thank you, William. It's been a pleasure to partner with Workday on this solution. Huron has been supporting healthcare industry since its inception. We support our healthcare providers with everything from strategic leadership, patient access and care, to optimizing clinical and administrative operations through process change management, and the use of technology. At Huron, I'm responsible for our enterprise performance management solutions for healthcare and higher education. Like William, I actually started when I was 10, though. I have over 30 years of experience working with academic medical centers, providers, and higher education institutions to streamline business processes and enable technology to support these processes. I'm excited to share with you all healthcare demand planning. So what is healthcare demand planning? Demand planning is holistic, collaborative, proactive, and allows for the forecasting and scenario modeling to meet patient demands. We think of this as a cyclical process that works in tandem. We need to understand the real-time impacts that ambulatory and surgical appointments have on space, staff, and stuff. For example, if we have an increase in a demand for a particular surgery, Will we have the supplies needed to perform those surgeries? And even more importantly, will we have them when we actually need them? On the flip side of that, we need visibility into the impacts that constraints could possibly cause on resources, space, staff, and our ability to provide patient care. If there's a disruption in the supply chain due to a natural disaster or a pandemic like we saw this year, that impacts the lead time for getting a particular item. We need to quickly understand which surgeries, how many, and when will they be impacted. Now that you have a definition of healthcare demand planning, we'd like to take a quick poll. Is your healthcare organization currently planning to do demand planning, forecasting, or scenario modeling for supplies, facilities, or provider availability? So we'll take a quick minute. Okay. Do we have results, Amy?
The results are still coming in, Ida, so I haven't ended the poll yet.
Okay, give it a few more minutes.
All right, look like we stopped climbing, so I'm going to end the poll and launch the results.
Great. All right, so not surprising, we've got the majority of you all that are in the know and I don't know category. And a lot of that is because healthcare demand planning is a very new concept, so these results kind of reflect what we're actually seeing, in the industry. So with that, I'm pleased to welcome David Farrell from Dayton Children's Hospital to the discussion. David, we would love for you to provide insights on why demand planning is such an important initiative for Dayton Children's Hospital. David?
Well, thank you very much. I'm David Farrell. I'm the Corporate Director of Supply Chain at Dayton Children's Hospital. I've been here for about 3 years, and in that 3 years, I've launched a Workday, a new ERP system, and then also, like all other supply chain professionals, have dealt with the pandemic over the last year. So back in March, and I won't take us back over all the details, but March 2020 is when all supply chain professionals, either strategic or tactical, basically went very tactical in securing supplies for their locations. With elective surgeries that were put on hold and also other items that were also on MBO, we ran into many roadblocks. So it took several months for us to dig out of that, just like everyone else. And during that time, I kept on asking myself, how can we plan better for this? Or what are our solutions to plan when we come out of this pandemic? You cannot plan for a pandemic, you can prepare for a pandemic. And that is one thing that led me to ask the question to Workday, my new ERP partner, of saying, what might be your next steps with demand planning for hospitals? And they came back with a great solution and a great meeting of the minds with Huron. And Huron basically took my advice and a couple other ideas that they already had, and we put together a list. And with that list, we kind of came up with a great solution. And in that solution, this program that Dayton Children's is looking at and cannot wait to launch is going to help everything from our surgery cases to scheduling our patients, to make sure that our supplies are there from the SMS items that were on back order because of the pandemic. All the other raw materials that affect scheduling for cases, that this program will be able to help us be able to then reschedule or push out or bring in alternatives. And that's the biggest thing for us as supply chain professionals is, if alternative A is not available, alternative B is not available, because that's the way it was during the pandemic. This is going to allow us to have that from an inventory control point of view, or even a supplier control point of view, because we know what cases are coming up. Workday and Huron have partnered on this great partnership, and I am so honored that Dayton Children's was one that was asked early on about demand planning. And I just am very thankful for that. And so thank you very much.
Great. Thank you very much, David. We're excited about partnering with you on this also. So we are going to, before we take a deep dive into the solution demonstration, I wanted to walk you through the technology architecture of the solution. So the Workday platform is what we use to build the solution. The key components of it that are actually running the analysis and modeling and forecasting are the Workday Adaptive Operational Planning and Prism. Prism serves as the data consolidation for our integration. And actually also serves on the other end of that, our visual ability to be able to provide discovery dashboards and visualizations. The Huron Accelerator is a configurable pre-built content that sits on top of and uses the Workday Adaptive Operational Planning functionality along with Prism. Optionally, we can connect the Workday Adaptive Operational Planning pieces for the demand planning to the Workday Adaptive Financial piece to basically be able to use the operational information to feed the financial plan and to use financial information to feed the operational plan. To bring this all together, we have to have data from other systems across the organization. From the Workday Financial Management, we bring in cost center information, spend categories, location, net revenue information. From Workday Human Capital Management, we're bringing in provider information, compensation information, location as to where providers are located, and possible job titles. The biggest pieces of the engine and information to feed the engine come from Workday Supply Chain Management. This is where all of our item master information comes from, our understanding of replenishment rules, supply cost, and then the second biggest pieces of information are coming from your electronic health records, your Epic, your Cerner, your MedTech. This is where we're pulling in appointments, referrals, procedures, visit types, item preference cards, information about bed availability, ORs, and provider information. Bringing all of this in to a central location that allows us to be able to model, plan, and forecast. And with that, I'd like to turn it over to Nick that will actually share with you the solution demonstration. Nick?
Hello, everyone. My name is Nick Sitnikoff, and I'm a solution architect with Huron. I've been working on this solution for the last 8 months with the Workday and the Huron teams from different departments, and I'm finally excited to show it to such a large group today. So I'm going to share my screen. And what we're going to do today is take a look at the sample application built, and we're going to show it from the perspective of 3 different individuals, personas: operational director, responsible for the overall health of the hospital, nursing manager, as well as the inventory manager that is responsible for day-to-day operation of the actual items in the supply chain. This dashboard that you see on the screen is basically aggregating all of the data that we would pull in from the Workday supply chain Epic system, put it all in the adaptive database, and then we use the dashboards to actually analyze and slice the data. So you see the charts and tiles in the middle of the screen, and then at the top there, you see the filters that you can apply to this data to see finer details about it. So right now, we're looking at it from the perspective of the operational director. And what they're able to see is for a time frame that is being selected, which is week 48 of 2020, by selecting a date over here at the top, we can tell that for this week, we're looking at potentially postponing 124 scheduled appointments. And this is further sliced into what is causing these potential constraints and postponements. So we have supplies, which basically stuff, right? Supplies, space, facilities, and staff, personnel. So we can tell right away that the largest issue at the moment is with our supply chain. So because of the lack of some items, we're potentially postponing 114 out of the 124 appointments. And then this chart at the bottom will show us the same numbers, except we're looking 7 weeks out in the future. So once the operational director is able to determine that the largest opportunity to improve the situation is within the supply chain, they can get in touch with the nursing manager, who in turn will get in touch with the inventory manager, and we'll talk about that right now. So I'm switching off to the next dashboard, and this is the nursing manager's view. So they can see the same information, focused specifically on the supply chain, 114 potential postponements out of 406 scheduled appointments for the week 48 of the year. And then top right, this person can see the breakdown by procedure that is causing these potential postponements. So right away, we can easily identify that once we hover, we see the full name. But basically, nasopharyngoscopy is responsible for 31 postponements out of 114. So naturally, this will be the first choice to look into and see what items it's utilizing to perform the procedure, so that by resolving these constraints, the situation can improve faster. The chart at the bottom represents basically sets of bars. Blue one showing the number of postponed appointments that are potentially at risk, and then orange bar represents the total number of appointments scheduled for a particular day, looking out a month in the future. So once the nursing manager is able to identify the procedure that they'd like to focus on, they can get in touch with the inventory manager, who in turn can look even further into the detailed constraints. And this is what we'll show on the third dashboard here. So this is the inventory manager's view. And once they kind of receive some guidance from the nursing manager, let's focus on nasopharyngoscopy. And then they will look further into this. What's important to understand is that it doesn't have to necessarily go in this direction. They can also proactively monitor the state of the potential postponements and initiate this conversation by saying, okay, I see the numbers climbing over here in this tile. Dear nursing manager, what should I focus on first in order for us to kind of alleviate this constraint, right? Once they do receive, though, that first thing they want to focus on is the nasopharyngoscopy, then they can apply this filter at the top to look at just the information related to this type of procedure. So now the tile here updates to 31 potential postponements out of 38 scheduled nasopharyngoscopy procedures for the week. And then what they see on the top right chart is the breakdown by inventory site. So essentially all of the procedures, obviously they utilize items, and then these items must be stored somewhere. So like now they want to determine which inventory site is the largest culprit of these potential postponements. And right away, Stark Warehouse seems to be the largest number. So they would be applying this filter to further narrow down their focus. So now that we're looking just at the Stark Warehouse, again, our tiles update here, 14 total appointments scheduled, 12 are potentially being postponed. This chart on the bottom right shows us the items that are causing these constraints. So right away, we can see there's two items, tube 502163, that is causing essentially all of these 12 postponements, as well as the drape, which is responsible for 2 out of the 12 postponements. And then this chart on the bottom left just shows us per day the procedures that are potentially going to be postponed. So once they took a look at what items are causing the issues, they can switch over to the next perspective. It's kind of like a sheet and Excel tab, and then a look at just the information specific to the item that they have identified. So I can select 502163, the tube, and all of the information here updates accordingly. So now we're kind of at the finest level of detail here. So we're looking at once we take a look at the top left chart, this shows us the turns annualized per year of inventory. And if we hover over this bar, we can see 2,366. Clearly, it's an incredibly large number. So essentially, we're reordering multiple times a day, and we keep turning this inventory. So something is going wrong here. This snippet on the bottom left shows us basically daily reorders in this row here. So like it's showing us that every day we have a flag to reorder 11111 for every day of the week, meaning it's a systemic issue. And then the balance or the overconsumption here shows us a negative number in the row for every day. So essentially we're overconsumed of this item every day. So this is a situation that is obviously like systemic, as I said. And then that is very likely there are some wrong parameters within the item master, right? That has been brought through from Workday. So this is an item master extract on the top right. And what we can see right away is that our minimum quantity and maximum quantity parameters are only 1 unit apart. So essentially we have minimum 0, maximum 1. And what that means is once we are projected to hit 0 inventory items on a particular day, we try to reorder up to the maximum quantity, which is 1. And if we have multiple procedures scheduled for a particular day, or a procedure uses multiple items, obviously this is not going to work. So an inventory manager at this point can update this number to some reasonable number that they determine based on their experience, apply this change, so I'm choosing 40, apply this change, and then see how this change will impact the rest of the charts and tile and the KPIs that we looked at. So we do see straight away that this item is no longer, doesn't have the highest turns per year anymore, and because it moved over to the right. And then the bar got a lot smaller, right? And then this sheet at the bottom is no longer showing us that we're planned to reorder every single day. So once we're happy, at least by having this cursory look at it, we can go to the first perspective and see how the data updates. So right away, this dropped down to 2, and the item has disappeared from the top 5 postponements kind of causes, right? And then we can proceed to the next item, which is 501047. And then here we can just remember that, oh, okay, so like all of the postponements are potentially have like basically for the surgery scheduled for the 2nd of December. It's something that will help us resolve this item. What is important to remember is that once you're happy with the changes you made here and the way they impact or influence the rest of the situation within the hospital, inventory manager can then go into Workday supply chain and actually apply these changes, make them permanent, and then they will be integrated back with adaptive on the next synchronization cycle. So now we can take a look at this second item, which was a drape 501047, and see what's happening with this one. I selected from my filter pane, and then let's see all the charts and sheets update here. So looking at the turns, we don't see anything abnormal. Like this item is not even appearing on the list of top 5. We can take a look at the item master and we see that, okay, nothing is obviously wrong here because we have a minimum of 1 and maximum of 300, at least on the surface, it seems fine. And then by looking at this sheet over here, we can see that we are essentially placing a reorder on the 3rd because we're in the negative balance and we're scheduled to be in the negative quantity over here, overconsumed. But we do know that the appointments themselves are actually scheduled to occur on the 2nd of December. So in order for us to try and model out a resolution, we can place an early reorder, kind of model a manual reorder override. And then in order to do that, we just enter 1 in this row to signify that we will be placing a reorder on that date, the 1st of December, and then we'll enter a quantity here. So say we'll say 300 items, right? Just to be consistent with this parameter here. And then we save that, and we see how that change can impact the rest of our dashboards. So this is saved, and now we can go back to the first perspective and see that this chart is pretty much empty. This chart is empty, and the top 5 items by postponements are empty. So this is kind of the cycle that inventory manager can go through, and then they would take a look at other inventory sites to see what the situation is there, and then kind of go back to the nursing manager, identify some other procedures that they can work to resolve, and then go through the same cycle until they're comfortable with the end result, right? To resolve the situation for this week. And then if they want to take a look at another week, they obviously change the time range, and then they go through the same process. All of these changes, once they are took place on the item manager's dashboard, inventory manager's dashboard, the nursing manager sees the same thing. So once they have their dashboard open and they just refresh it, they have these numbers drop, different procedure pop up here as the top cause of postponements, and so on and so forth. And they can report back to the operational director, who in turn sees changes happen on his side, right? What another big kind of part of this model that we wanted to show you is the ability to model what if scenarios. So if I were to switch to a different version, and this is a version selector there, so we're going to switch over to Q1 what if scenario on the operational manager's side, and then we'll do the same on the inventory manager side, just to show you how the drivers that operational director can adjust or flex, they will be reflected on the inventory manager's dashboard. So I'm just going to select the same procedure just to show you that we're essentially at 0 postponements for the week. And then we're going to flex these drivers on the operational director's side. So we're choosing nasopharyngoscopy, as well as the start warehouse, the parameters that we were working with. So we see that we don't have any postponements predicted for the week of the 1st of December. So now if we go to the operational director, if we scroll down, there's 2 of these snippets. I'm just going to filter on this procedure as well so that we can actually read. There's a lot of, obviously, rows here, so we can focus, narrow down our focus here. So this sheet allows us to model out a potential increase in patient's demand for a specific procedure. So this time it's the same one, nasopharyngoscopy. So by entering 50 here, we essentially will model a 50% increase in demand for this specific procedure for that week, week 48, right? We save that change. And another thing we're going to layer on top of that is that for the drape item 501047, now it's going to take 30 days to receive the item. So essentially a 30-day lead time for the supplier to supply this item. And we save that change as well. This change is modeled monthly, but these are the finer details that can be adjusted for your specific planning method. Now, once we made that change, we can go to the inventory manager's dashboard and see how these drivers have impacted the situation within the hospital. Right away, we see the numbers spike up to 15 over here on the potential postponement side, as well as list out 3 items that are now causing this issue, right? We have a new item pop up, tray irrigation, and then these same ones that we worked with in the first example. So we have a tube 502163, right? Now it's spiked to 5. The reason is that now we have obviously more procedures that require more of this item, and maybe our regular reordering schedule of 40 is no longer able to support that spike in demand. And then this 501047 is essentially causing all 15 because not only there's more of this item required, but also the lead time is now causing another strain. What could be a potential resolution here? Obviously, there's an opportunity to play with the item master parameters or the reordering schedule, similar to what we showed. But another potential workaround is to try and identify other suppliers that will just go against the vendor list and see if another supplier can provide a more preferential terms of delivery, or maybe work with providers and see if there are substitute items within the item master that are not as constrained and there's more of them in the inventory, or they can be delivered faster. And if the providers are happy to substitute some of these items, that could be a potential resolution. So this is what we wanted to show here. Another thing that I wanted to point out, if I just go back to the original version here on the operational director side. As you remember, there were a few constraints, not just the supply chain. So we have supply chain, facility, and provider. We're not going to go too deep into the other ones, but we do have providers also causing a constraint here because of maybe their schedules are basically there's more demand that their schedules can support at the moment, and they're overutilized, or maybe some of them like are not currently providing care. Whatever it may be, this is being caused, right? There's 10 potential postponements. So there is another dashboard specifically for that purpose, and it looks something like this, right? And then there's obviously a similar one for the facilities, but we currently don't have any constraints. But just from a brief look, we can tell, okay, there's 10 postponements in this category, and it looks like all of them, for whatever reason, are associated with Brandon Abbott, and this is something we can focus on. And all of them, in fact, are only for laparoscopic cholecystectomy, right? So this is just an example of what this dashboard might show, and then they would show basically the dates that are being impacted by this constraint here at the bottom.
Thank you, Nick. So as you all saw, what we believe the value of demand planning solution will bring in healthcare is the ability to improve process efficiencies and visibility. You saw in the demonstration the ability to take all of that information, bring it into a single location, and have multiple people working and seeing the information at the same time. What this does is improve productivity by removing the low value added tasks, such as trying to, extract data from pieces, pull it into a spreadsheet, and try and get visibility around that. It also provides timely visibility into demand, supply, and resources availability, and allow for that what if modeling so that you can react to information real time. What do both of these do combined is they also improve patient care and access by optimizing patient access and optimizing cost. By better being able to match demand with supply, we can rapidly identify where there are areas that we may need to do something different. So like Nick said, whether that's looking at different, options for getting our supplies in, whether it's looking at, can we bring on additional providers to meet those demands? But we have the ability to act proactively by seeing that information. We can also look at reducing supply chain costs, by being able to react quickly and understand ahead of time. So instead of waiting to the last minute to have to order supplies for something, can we order ahead of time and not have to pay the additional costs for an expedited delivery? All of this provides improvement that allows for productivity improvement, process consistency and data quality, acceleration on reporting, more granular intuitive visibility, enhanced utilization of physicians, reduce inventory and supply chain costs, possibly increase work RVUs, increase managed care percentage, and optimize operating room utilization. So key takeaways from this, a call to action. To be able to do this, you need to be able to think differently. Think differently means that you use the vulnerabilities of what has happened over the last year as an opportunity to think about your processes differently. Plan differently. Develop a strategy that is bold and moves towards the next generation of technology. Act differently. To enable this, you will need forward-thinking leaders that are ready to embrace a digital transformation that will better serve patients, clinicians, and staff. Before we open it up for questions, we'd like to take one last audience poll. Now that you've seen what is possible for healthcare demand planning, how ready is your organization to move forward with demand planning? So we'll give you a few minutes to answer that poll. And then also while you guys are answering the poll, feel free in the Q&A section to ask any questions that you may have.
Ida, I think we're all set. So I'm going to end the poll and launch the results.
Okay, great. All right, thanks, Amy. All right, so 37% of you are considering moving forward. 40% of you are not sure if you're ready yet. And 23% of you are thinking that there are too many barriers for you to move forward. So, that's pretty what we would expect, so I am glad to see the number of you all really looking at, how you can start to use this in your organizations and move forward with that. For those of you who, are thinking that there are barriers, to preventing you from doing that, we would love to talk to you about what those barriers are, and how do you get to that next level. So with that, I'd like to now open it up for Q&A, and really excited to hear any questions that you all may have. And then, we can answer them as we go. All right. Amy, do we have any questions?
Ida, we've got one question that's come in through the Q&A window. Someone is asking if they're not currently using Workday for HCM and supply chain, can we still use adaptive planning to improve productivity in supply chain or other clinical areas?
So yes, even though the solution is built on the Workday platform, and the advantage of that is the integrations between, the delivered applications on the Workday platform, we can enable this in a platform where we bring data in from non-Workday sources. It does take a little bit more time on the integrations and some of the things that need to be done, but it is possible. Thank you, Amy. Any other questions? All right. Well, thank you for your time today. We really appreciate taking time out of your busy schedules to learn a little bit about where we're trying to take healthcare and advancing it, to the next generation of being able to provide, great quality care. You have our contact information on there. If you've got questions about anything, please feel free to reach out. We will also be sending you all a copy of the recording of this presentation, and really excited about, talking with you all about where you all are going next. So again, have a wonderful day. Thank you very much and appreciate your participation.